The overall purpose of today is to start the process of raising the community's awareness about how serious the issues are regarding children's mental health.
It's a pleasure to welcome you all here.
We're trying to study the effects of the environment on the genome, on the structure and function of the brain, and then on subsequent behavior. We're doing all that in the service of children and families who struggle with emotional behavioral problems, with the goal of identifying new ways to get in the way of adversity and promote health.
We shouldn't see ourselves as advising those who are running healthcare reform, but in fact driving healthcare reform.
By taking an approach to build emotionally strong people, we'll diminish drug and alcohol abuse, criminal behavior, school failure. Rochester has not very good high school graduation rates. They have an encroaching and growing problem with poverty. Both of those are incredibly strong signals for the need to promote health in children and adolescents.
There are evidence-based prevention therapies that can be used with young ages, and if we can get kids at 3 and 4, we can mitigate the effects of stress and trauma. Mental illness is an illness no different than asthma or cancer or other illnesses that need prevention and treatment.
Right now, in our psychiatric emergency department at Strong, almost 40% of our volume is under 18 years old. It's the most significant healthcare issue and challenge that children and families face today.
It's not a function of race, it's not a function of income, but it's in fact a community problem. And the core issue is how much do we care about our children? How much do we care about the future?
If you think of the fact that kids that have behavioral health issues are more likely to be in the juvenile system, costing us money. They're not completing school, they're not getting degrees, they're not out working as productive citizens. I can't put a number on it, but it certainly is a huge impact economically.
This is something that can be dealt with. This is not some hopeless task that we just have to live with. There are a lot of things we can do to make this better. And so, despite the fact that it's a little alarming, the condition, I came away with some optimism about it.
The ideal outcome of this report and this event is to motivate people for change. And then the ideal outcome of the change is no more wait lists, that children and families have ready access to mental health evaluation and care.
So thank you, and we look forward to working with all of you.